As we've been reporting, worker shortages are impacting many industries right now, from hospitality and food service to education, transportation, and healthcare. Tonight, we want to narrow the focus and take a look at mental health services. Alma McCarty joins us now. And Alma, there's more need for this type of care right now, but it's harder than ever to fill those positions.
Yeah, I spoke with the CEO of LifeWorks Northwest, which has been providing addiction and mental health services in our area for 6 decades. It almost goes without saying, these services are so important, but it's becoming harder to get them between a shrinking workforce and a greater burden placed on current staff.
It's been a long couple of years. In that time, Mary Monnet says more people of all ages have realized they might need help to deal with things like anxiety, depression, addiction.
We're at, honestly, a really tough crossroads.
She explains mental health and addiction services providers like LifeWorks Northwest want to rise to meet the need. But right now, she says they're in a world of hurt.
We have this collision of increased need, lessening of the workforce, and it's just led to, honestly, a crisis in our field where we're having fewer and fewer workers to do the most critical work that's honestly life-saving work.
Monnet says mental health professionals are doing their best to keep things stable, like taking on more existing patients. But there are limits.
But imagine, you're in crisis, you need care, and we say, yeah, we'll see in 3 months.
For LifeWorks Northwest right now, compared to pre-pandemic, there are 30% fewer new people entering into the system for care because there isn't capacity to accept them. The provider employs nearly 575 people, but there are more than 90 job openings. Across the Portland area, Monnet estimates there are about 500 open jobs between the other big mental health organizations.
Pre-pandemic, we had same-day access. It was a model we used, just come on in, like we don't want any barriers. With the pandemic, we can't operate, because COVID. More, it was the workforce, right? We can't accommodate people coming in like that.
The focus now, keeping the professionals they do have while finding ways to attract new workers. Monnet says retention and hiring bonuses only go so far. While the people drawn to the profession aren't in it for the money, wages must improve.
It's all about the base. We have to get that higher so we can continue to build and to have a workforce that's sustainable, a wage that's sustainable, that lets people plan for the future.
In March, LifeWorks Northwest and other organizations will partner up through the Washington County nonprofit Vision Action Network to hold a summit to address workforce challenges.
We've always offered support, but we're trying to just get more and more creative about how do we keep the people we have engaged and supported.
Now, clearly, the pandemic revealed many issues, but Monnet tells me there is a silver lining here. Telehealth. LifeWorks Northwest pivoted to provide services virtually, something she believes will have its place and stick around for good.